Hey folks, Dr. Jeff Williams with Creekstone Integrated Care right here in Amarillo, Texas, back this week with another research-based evidence blog just for you. For some reason, regardless of the evidence and research, including randomized controlled clinical trials that are out there in support of chiropractic, in support of manual therapies and spinal mobilization, there's still those that continue to disparage the profession rather than educate themselves on the efficacy. I believe it's true with every profession that we have outliers in our profession. Most people are sensible enough to understand that there are outlier plumbers that will take advantage of a person just because they're in the position to do so. There are mechanics changing perfectly good automotive parts, surgeons doing questionable or unnecessary surgery. There's insurance salesmen that will sell you insurance coverage that they know is not going to do you a lot of good. And there are chiropractors out there that will make claims they should not make and will see you when it won't necessarily make much difference to your health. I think it's understandable that outliers do exist, and avoiding outliers is just part of navigating throughout life. There's even a quote for it: "Fool me once, shame on you. Fool me twice, shame on me," right? But it seems that outliers get more attention in the chiropractic profession than do the highly educated and highly professional practitioners that are truly getting people well every single day. This is, for obvious reasons, highly frustrating. It's also through continual and consistent sharing of the research and evidence that the chiropractic profession will change and eventually overcome this situation. I have faith that solid research and evidence can only be ignored for a specific amount of time. There's a shelf life, if you will, on its being ignored. So with that in mind, here's some research showing effectiveness of spinal manipulative therapy and or mobilization for low back pain and neck back pain. Now here's why they did it. As said above, the authors felt that there were a multitude of randomized clinical trials, reviews, and national clinical guidelines regarding chiropractic for low back pain and neck pain, but that there still remains some controversy as to the effectiveness among some in the medical field. Imagine that. They wanted to step back and review all of the information, only accept valuable papers on the topic, and generate a solid opinion on chiropractic effectiveness for treating low back pain and neck pain. So here's how they did it. They chose papers on randomized trials from around the world through computerized databases. They used 2 independent reviewers to check the quality of the papers using guidelines that they laid out before starting the project. 69 randomized clinical trials were reviewed. Only 43 of those ultimately met the predetermined criteria and were ultimately accepted for inclusion in the review. Now here's what they found. There is moderate evidence that chiropractic has more effectiveness for short-term pain relief than does mobilization, and limited evidence of faster recovery over physical therapy. For chronic low back pain, there is moderate evidence showing that spinal manipulative therapy has an effect that is equal to prescription non-steroidal anti-inflammatory drugs. Also, spinal manipulation and mobilization show effectiveness in short-term relief over that of a primary practitioner, as well as superiority in the long term when compared to physical therapy. There is moderate to limited evidence showing that chiropractic is superior to physical therapy in the long term and the short term treatment of low back pain and neck pain. For a mix of short and long term pain, chiropractic was either similar or superior to McKenzie exercises, medical treatment, or physical therapy. So let's wrap that up and tie a little knot on it. The authors concluded that recommendations can be made with confidence regarding the use of spinal manipulative therapy and or mobilization as a viable option for the treatment of both low back pain and neck pain. Just another reason to call a chiropractor today, right? Research and clinical experience shows that in about 80 to 90% of headaches, neck and back pain, In comparison to the traditional medical model, patients get good or excellent results with chiropractic. Chiropractic care is safe, it's more cost-effective, it decreases your chances of having surgery, and it reduces your chances of becoming disabled. We do this conservatively and non-surgically. In addition, we can do it with minimal time requirements and minimal hassles on the part of you, the patient. And if the patient develops a preventative mindset going forward from initial recovery, we can likely keep it that way while raising your general overall level of health. Please feel free to leave a comment. Tell me your thoughts. I'd love to hear what you think. Tell us your thoughts down in the comment section just below. Please make sure you come and find us on social media outlets like Facebook, Twitter, Pinterest, LinkedIn, Google+, Instagram, and make sure you subscribe to our YouTube channel by hitting the button below. At the very least, do us a favor by hitting the thumbs up button. It really helps us get in front of more and more people with some information that we hope, over time, will start to make a difference in our profession. Thanks again, and until next time, have a blessed day.